Have you ever eaten a fruit thinking it was good for you, only to find out it might be causing more harm than good? It's a surprising truth that many seniors face without even realizing it. In this video, I reveal 6 common fruits that could be dangerous for your health, especially if you have diabetes, kidney issues, or heart conditions. But don't worry, I'll also show you how to enjoy these fruits safely. Stay with me until the end, because what you learn today could help you prevent serious health problems and keep you feeling strong and energetic for years to come. Before we begin, I would appreciate it if you like this video so I can continue to spread these old age lessons. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. And if you like this video, please comment number 1, or if you don't like it, comment number 0 to let me know so I can make a better video for you. Now let's get started. 1. Star fruit. Let's dive into a fruit that often flies under the radar. Star fruit. With its striking star-shaped slices, vibrant yellow hue, and a sweet, tart flavor, star fruit seems like an exotic treat that could brighten anyone's day. It's the kind of fruit you might spot at a farmer's market or in the tropical section of a grocery store, and you might think, why not give this a try? For many, it feels like a healthy, adventurous choice. Low in calories, high in vitamin C, and packed with antioxidants. But here's the catch. For seniors, especially those with kidney problems, this seemingly harmless fruit can turn into a hidden danger lurking in plain sight. What makes star fruit so risky is a little-known toxin called carboxin, naturally present in the fruit. In a young, healthy body, the kidneys act like a top-notch filtration system, swiftly removing carboxin from the bloodstream. No harm, no foul. But as we age, our kidneys don't perform with the same vigor they once did. Kidney function declines gradually over time. And for seniors, this means that carboxin doesn't get cleared out as efficiently. Instead, it lingers in the body, building up in the bloodstream, and setting the stage for serious health complications. Let's talk about John, a 72-year-old retiree living in Tampa, Florida. John was the picture of conscientious living. He prided himself on his healthy habits, daily walks, plenty of water, and a diet rich in fresh fruits and vegetables. One day, while browsing the produce aisle, he spotted star fruit and thought it would be a fun, nutritious addition to his morning routine. He started blending it into his smoothies, enjoying its juicy sweetness and feeling good about trying something new. For the first few days, everything seemed fine. But then subtle changes crept in. John began feeling dizzy. Nothing major at first, just a slight wobble when he stood up. Then came the confusion. He'd walk into a room and forget why he was there or struggle to find the right words during a conversation. He chalked it up to a long day or perhaps not drinking enough water. But soon, fatigue hit him like a freight train. He felt drained, barely able to get through his usual chores. One morning, things took a terrifying turn. He woke up, looked at the calendar, and couldn't remember what day it was. Alarmed by his disorientation, his family rushed him to the emergency room. After a flurry of tests, blood work, scans, and a detailed medical history, the doctors pinpointed the cause: star fruit toxicity. It turned out John had mild kidney disease, a condition he'd never been diagnosed with, and had no symptoms of until now. The carboxin from the star fruit had accumulated in his system, overwhelming his compromised kidneys and wreaking havoc on his nervous system. John's story isn't just a fluke. It's a stark reminder of how deceptive this fruit can be. The National Kidney Foundation has sounded the alarm, warning that even a small serving of star fruit, just a few slices or a single fruit, can be life-threatening for seniors with reduced kidney function. In fact, 1 in 3 adults over the age of 65 has some form of kidney disease, and many don't even know it, because kidney disease can be a silent condition creeping along without obvious symptoms. So even if you feel fine and assume your kidneys are in tip-top shape, there's a chance they're not. Star fruit, then, is a gamble not worth taking. Let's break down exactly what happens when carboxin overstays its welcome in your system. This toxin isn't just a minor nuisance. It's a neurotoxin, meaning it specifically targets the nervous system. It can manifest as dizziness and confusion, which are often the first red flags. The toxin disrupts normal brain signaling, leaving you feeling off balance and foggy-headed. It causes severe fatigue as your body struggles to cope with the toxin, sapping your energy and making even simple tasks feel exhausting. Memory problems can set in. Short-term memory may falter, turning routine days into a disorienting blur. In more severe cases, carboxin can overstimulate the nervous system, triggering convulsions or even coma if the buildup becomes extreme and remains untreated. Studies have shown that star fruit can cause acute kidney injury in people with pre-existing conditions, turning a mild issue into a full-blown crisis. So why do seniors keep reaching for star fruit despite these risks? It's not hard to see the appeal. Star fruit has an exotic charm. Its unique shape and tropical origins make it feel special, a departure from everyday apples and bananas. It's sweet, juicy, and refreshing, a perfect snack or garnish. Plus, it's often marketed as a superfood brimming with vitamin C, fiber, and antioxidants, qualities that sound tailor-made for health-conscious older adults looking to boost their diets. But for those with compromised kidneys, this healthy choice is a wolf in sheep's clothing. When you see star fruit on the shelf with its glossy finish and promise of exotic flavor, remember, for seniors, especially those with kidney issues, the potential for dizziness, confusion, seizures, or worse far outweighs any nutritional perks. The next time you're tempted to toss a star fruit into your cart, think twice, leave it behind, reach for a safer alternative, and let your kidneys and nervous system breathe a sigh of relief. If you're still watching this video and finding these insights valuable, please comment number 1 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. 2 grapes. Let's dive into a fruit that's a staple in nearly every household. Grapes. They're a convenient, bite-sized treat bursting with juicy sweetness and are often hailed as nature's candy. A go-to-healthy snack found in lunchboxes, fruit bowls, and as a quick pick-me-up on busy days. At first glance, grapes seem like an innocent, wholesome choice. But for older adults, this seemingly harmless fruit can hide some unexpected dangers. Grapes pose 2 significant health risks for seniors: sudden blood sugar spikes and a surprisingly high choking hazard. First, let's talk about the sugar content. Did you know that a single cup of grapes, about 150 grams or a modest handful, contains roughly 23 grams of sugar? To put that into perspective, that's equivalent to the sugar in 4 standard sugar cubes or a small candy bar. Yes, it's natural sugar, not the refined stuff you'd find in a donut, but that doesn't mean it's harmless for seniors. Particularly for those with diabetes, prediabetes, or even just a family history of blood sugar issues, this could be a real concern. As we age, our bodies don't handle sugar as efficiently as they once did. Metabolism slows, insulin sensitivity can decrease, and the pancreas might not pump out insulin as effectively. Even natural sugars like those in grapes can hit your system like a freight train, causing blood sugar levels to soar. You might feel a quick burst of energy followed by a crash that leaves you exhausted, foggy-headed, or grumpy. Over time, these spikes can strain your system, increasing the risk of heart disease, worsening diabetes complications, or even contributing to weight gain if grapes are a regular part of your diet. Take Patricia, for example, a 68-year-old retiree from Chicago. Patricia had always been mindful of her health, but after a recent checkup showed her blood sugar creeping up, she decided to make a change. She swapped her usual afternoon cookies, a habit she'd enjoyed with her tea, for a bowl of seedless red grapes. "It's fruit," she told herself. "It's got to be better for me." She pictured herself making a smart, virtuous choice by cutting out processed junk for something fresh and natural. But a few weeks later, things took an unexpected turn. Patricia started noticing that she felt unusually tired even after a full night's sleep. Her vision would blur slightly in the afternoons, and she'd get lightheaded after eating, symptoms she hadn't experienced before. Worried, she dug out her old blood sugar monitor from her prediabetes days and tested herself after a grape snack. The reading floored her at 180 milligrams per deciliter, far higher than her usual range of 100 to 120. confused and frustrated. She booked an appointment with her doctor. "I thought I was doing the right thing," she told him, her voice tinged with disbelief. Her doctor reviewed her diet and zeroed in on the culprit almost immediately. Those innocent-looking grapes. Even though Patricia had ditched the sugary processed snacks, the natural sugars in grapes were hitting her system just as hard, maybe even harder. Research from Harvard Medical School backs this up, noting that grapes have a high glycemic index, meaning they can spike blood sugar faster than some processed foods like whole grain bread. For seniors whose bodies are less equipped to smooth out those spikes, a healthy snack can turn into a hidden health hazard. But sugar isn't the only issue. The second danger grapes pose for seniors is their potential as a choking hazard, a risk that's less obvious but just as serious. As we age, our swallowing reflexes naturally weaken. The muscles in the throat don't coordinate as smoothly, and the gag reflex might not kick in as quickly. Foods that are small, round, smooth, and slippery, like grapes, are prime candidates to get lodged in the windpipe. They're just the right size to block an airway if swallowed whole or not chewed thoroughly, and their slick skin makes them tough to dislodge once stuck. The numbers tell a sobering story. According to the National Safety Council, choking incidents involving grapes among seniors have jumped by 30% over the past 5 years. Part of the uptick is due to increased awareness. Doctors and caregivers are reporting these cases more often, but it's also because seniors are eating grapes without realizing the risk. Imagine watching TV, popping grapes absent-mindedly, and one slips down before you've chewed it enough. For a younger person, a quick cough might fix it. For an older adult, it could turn into a life-threatening emergency. So does this mean grapes are off the table entirely? Not necessarily. If you love them, you don't have to banish them from your kitchen forever, but you do need to be strategic. Here's how to enjoy grapes without rolling the dice on your health. Cut them up. Slice each grape into quarters before eating. This not only reduces the choking risk by making them less likely to get stuck, but also slows down how quickly you eat them, giving your body more time to process the sugar. Pair them smartly by combining grapes with a protein or healthy fat like a small cube of cheese or a handful of almonds. This helps buffer the sugar rush by slowing digestion and absorption. Watch your portions. Limit yourself to about 6 small grapes at a time, about half a cup. That's enough to satisfy your craving without overloading your system. And if you're open to switching things up, there are safer senior-friendly alternatives that deliver flavor and nutrition without the risks. Fresh berries like strawberries or blueberries, which are lower in sugar and packed with antioxidants, or melon, watermelon, cantaloupe, or honeydew cut into small, manageable pieces that are hydrating, naturally sweet, and far less likely to cause trouble. The bottom line: grapes may look like a harmless little fruit, but for seniors they're a classic case of proceed with caution. Whether it's their surprisingly high sugar content sneaking up on your blood glucose, or their sneaky potential to turn a snack into a choking scare, they're not as innocent as they seem. By being mindful of how you eat them, or exploring other options, you can keep enjoying your food without putting your health on the line. After all, staying safe and feeling good shouldn't mean giving up the simple pleasures, just tweaking them a little. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. 3. Oranges. Let's talk about a fruit that almost everyone loves: oranges. They're juicy, refreshing, and packed with vitamin C, often celebrated for boosting the immune system. At first glance, they seem like the perfect healthy snack. But here's a surprising truth that many overlook. Oranges can pose significant risks for seniors, particularly due to issues like acid reflux, medication interference, and dental damage. While oranges have long been a breakfast staple, as we age our bodies don't process citrus fruits the same way they once did. Consider the acid reflux trap. Have you ever felt a burning sensation in your chest after eating or drinking something acidic? That's acid reflux, medically known as gastroesophageal reflux disease, GERD, a condition where stomach acid flows back into the esophagus. It's incredibly common among seniors, Over 60% of adults over 60 experience it, according to the GERD Foundation. Oranges, along with other citrus fruits, are among the top triggers for this condition due to their high acidity. This can lead to a range of uncomfortable symptoms, including heartburn and indigestion, a painful burning feeling that can linger for hours, throat irritation from acid exposure, and disrupted sleep due to nighttime reflux that wakes you up or prevents restful sleep. For many seniors, this discomfort can become a daily struggle, and the culprit might be hiding in plain sight: your morning orange. Take Margaret, a 73-year-old retiree from Minnesota, as an example. She suffered from frequent heartburn for years, chalking it up to the natural effects of aging. She tried various over-the-counter remedies, but nothing provided lasting relief. It wasn't until she eliminated oranges from her diet that she noticed a dramatic improvement. Margaret's story highlights how a seemingly innocent habit can silently wreak havoc on your well-being. If you've been dealing with acid reflux, frequent burping, or stomach discomfort, it might be worth reconsidering that daily orange. Beyond digestive issues, oranges present another serious concern for seniors: medication interference. Many older adults rely on daily prescriptions to manage conditions like high blood pressure, high cholesterol, or depression. According to the Mayo Clinic, oranges and orange juice can reduce the absorption of over 50 common medications, making them less effective. This happens because citrus fruits contain compounds that block enzymes in the body responsible for metabolizing these drugs. As a result, the medication may not work as intended, potentially putting your health at risk. For example, blood pressure drugs such as atenolol and felodipine, cholesterol-lowering statins like simvastatin, and even some antidepressants can be affected. Picture this. You take your blood pressure pill every morning, assuming it's keeping your numbers in check, only to discover that your glass of orange juice has been undermining its effectiveness. For seniors who depend on these medications to stay healthy, this interference can have serious consequences. It's wise to consult your doctor about whether citrus fruits might be affecting your medications. There's one more risk that often flies under the radar: dental damage. As we age, the enamel, the hard protective outer layer of our teeth, naturally thins out. Acidic foods like oranges accelerate this erosion, leaving teeth more vulnerable. This can result in tooth sensitivity, pain, or discomfort when eating hot, cold, or sweet foods, an increased risk of cavities, and even gum irritation if the acid inflames sensitive gum tissue. If you still want to enjoy citrus without the dental fallout, try rinsing your mouth with a glass of water afterward, or sip your orange juice through a straw to limit contact with your teeth. However, the safest approach for seniors, especially those with acid reflux, medication needs, or dental concerns, might be to cut back on acidic foods like oranges altogether. If you're worried about missing out on vitamin C, don't worry. There are plenty of gentler alternatives that deliver the same immune-boosting benefits without the risks. Consider bell peppers, which surprisingly pack more vitamin C than oranges and have far less acidity. Kiwi, sweet, tangy, and loaded with nutrients. Strawberries, a low-acid fruit that's easy to add to yogurt or oatmeal. Or even vegetables like broccoli and Brussels sprouts. These choices are kinder to your stomach, teeth, and medication regimen. Here are some practical tips if you can't imagine life without oranges. Eat them at the right time. Have them in the middle of the day rather than first thing in the morning or before bed to lessen the strain on your digestive system. Mind your medications by waiting at least 2 hours after taking them before consuming citrus. Dilute the juice by mixing it with water in a 1-to-1 ratio to reduce its acidity. And balance your meal by pairing oranges with alkaline foods like bananas or avocados to counteract some of the acidity. While these strategies can help, they don't erase the risks completely. If you're still watching this video and finding these insights valuable, please comment number 3 below. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. 4. Avocados. Let's turn our attention to a fruit that's been crowned a nutritional superstar in recent years: avocados. With their rich, creamy texture and reputation for being packed with heart-healthy fats, avocados have become a darling of health enthusiasts everywhere. You'll spot them smashed on toast, blended into smoothies, or even scooped straight from the skin with a sprinkle of salt. They're often touted as a must-have addition to a balanced diet, loaded with potassium, fiber, and those coveted monounsaturated fats. But here's the twist that many seniors might not see coming. Avocados can lead to unexpected weight gain, throw a wrench into how certain medications work, and even spark allergic reactions that catch you off guard. Aren't avocados supposed to be healthy? And you're not wrong. They do bring impressive benefits to the table. Those healthy fats can support cholesterol levels, and the vitamins can give your immune system a boost. But for older adults, the story isn't so straightforward. The key lies in understanding portion control, medication interactions, and your body's changing tolerances. Let's peel back the layers and explore why this trendy fruit might not always be the senior-friendly superfood it's cracked up to be. First up is the caloric pitfall. A medium-sized avocado, about 150 grams without the pit, clocks in at around 240 calories. To put that in context, that's roughly the same as a cheeseburger from a fast food joint or a hearty bowl of oatmeal with toppings. For younger folks with faster metabolisms, that might not raise an eyebrow. But as we age, our metabolic rate slows to a crawl, and our daily caloric needs can shrink to as little as 1,600 to 2,000 calories, depending on activity levels. That means a single avocado can account for a big chunk of your day's energy intake, even if you're not piling on extras like bread or dressings. This calorie density can sneak up on you, especially if you're thinking it's just fruit. Consider Robert, a 75-year-old retiree from Denver. Robert had read all the hype about avocados being a superfood and decided to jump on the bandwagon. He started his mornings with avocado toast, half an avocado mashed on a whole grain bread, a drizzle of olive oil, and a dash of pepper. It felt like a wholesome upgrade from his old butter and jam routine, and he was proud of his healthy switch. But 3 months later, Robert stepped on the scale and was stunned to see he'd gained 12 pounds. That extra weight didn't just mess with his self-esteem, it took a physical toll. His already creaky knees started aching more with every step. He felt sluggish, as if he were dragging himself through the day, and his energy just wasn't what it used to be. Puzzled, he mentioned it to his doctor during a routine visit. After a quick rundown of his diet, the doctor pointed to the avocado toast. "You're eating a meal's worth of calories in one sitting," he explained, "and your body doesn't need that much anymore." The American Heart Association echoes this caution, urging seniors to keep a close eye on portion sizes. With high-fat foods like avocados, even the good kind of fat can add up fast. There's also the matter of medication interference, a hidden risk beyond the calorie trap. Studies have shown that avocados contain compounds like vitamin K and certain enzymes that can interfere with how your body absorbs or processes key drugs. For instance, blood thinners such as warfarin, a common prescription for preventing clots, can have their effects counteracted by the high vitamin K content in avocados, making them less effective and potentially raising your risk of complications. Similarly, some blood pressure medications and certain antidepressants, like some SSRIs, can have their absorption altered by the fats and nutrients in avocados, leading to uneven results. This isn't something doctors always flag up front unless you specifically ask, "Hey doc, will this avocado toast mess with my pills?" For seniors managing hypertension, heart conditions, or mental health with daily meds, this oversight can turn a healthy habit into a risky one. Imagine diligently taking your blood pressure meds, only to find your readings creeping up because of that guacamole you had at lunch. If you're on any of these medications, blood thinners, antihypertensives, or mood stabilizers, it's worth a quick chat with your doctor or pharmacist before making avocados a regular part of your diet. Then there's the allergy angle, which might sound surprising for a fruit you've eaten without issue for years. Avocados contain proteins that are structurally similar to those in latex, a material found in gloves, balloons, and various medical supplies. This overlap triggers what's known as latex fruit syndrome, and research estimates that about 6% of seniors have some degree of latex sensitivity. For those individuals, avocados can set off a reaction. Think itching or swelling in the mouth, throat irritation, digestive upset, or even red, irritated skin after handling them. Here's the unsettling part. Allergies aren't static. Your immune system can shift as you age, meaning you might sail through decades of enjoying guacamole only to develop a sensitivity in your 70s or 80s. For example, Margaret, a 72-year-old from Phoenix, loved her weekly avocado salad. One day, after years of enjoying it, she noticed her lips tingling and her throat feeling scratchy after eating. At first, she chalked it up to something else, maybe a spice in the dressing, but when it happened again, she saw an allergist. It turned out her mild latex sensitivity from years of using gardening gloves had crossed over to avocados. It's a reminder that just because you tolerated something fine in the past doesn't mean your body will give it a free pass forever. So, does this mean avocados are no-go? Not entirely. If you're hooked on their creamy goodness, you can still enjoy them with some guardrails. Here's how to play it safe. Keep it small. Limit your intake to about 1/4 of an avocado per day, roughly 60 calories. That's enough to get the flavor without overloading your system. Never eat avocado solo. Combine it with protein, like a boiled egg, or fiber, like a handful of veggies, to slow digestion and blunt the calorie impact. And if you're on blood thinners, blood pressure drugs, or antidepressants, check with your doctor to confirm that it's safe for your regimen. If you'd rather sidestep the risks altogether, there are plenty of alternatives that deliver similar benefits without the baggage. For example, drizzle a teaspoon of olive oil over your salad, a heart-healthy fat you can measure precisely, or grab a small handful of walnuts or almonds, which are rich in nutrients, easy to portion, and free of medication interference. The takeaway is this. While avocados might be riding the superfood wave, for seniors they're a classic example of too much of a good thing. Whether it's the calorie creep that pads your waistline, the potential to throw your medications out of whack, or an allergy that sneaks up with age, avocados demand a little caution. You don't have to ditch them entirely. Just approach them with eyes wide open, a measuring spoon in hand, and perhaps a quick call to your doctor. After all, staying healthy shouldn't mean falling for every food trend that comes along. If you're still watching this video and finding these insights valuable, please comment number 4 below. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. 5. Watermelon. Let's talk about a fruit that's practically synonymous with summer, watermelon. It's sweet, juicy, and bursting with water, a favorite for staying refreshed on hot days. At first glance, watermelon seems like an ideal choice for seniors looking to beat the heat and stay hydrated. But here's the catch. Watermelon can pose some serious health risks for older adults, particularly those with heart conditions, kidney disease, or diabetes. Let's break down why this summertime staple might not be as harmless as it appears and explore how seniors can still enjoy it safely. One issue is too much water too fast. Watermelon is 92% water, which sounds like a hydration win. But for seniors, that high water content can be a double-edged sword. As we age, our kidneys don't process fluids as efficiently as they once did. Eating large amounts of watermelon can lead to fluid retention, where your body holds on to excess water instead of flushing it out. This can cause swelling. You might notice puffiness in your ankles, hands, or face, and even shortness of breath if extra fluid presses on your lungs. Increased blood pressure is another concern, as too much water in your bloodstream forces your heart to pump harder, which is risky if you already have heart issues. Consider Betty, a 78-year-old from Arizona. She started eating watermelon every afternoon, thinking it was a smart way to stay hydrated. Within days, her feet swelled, and she felt unusually tired. One night, she woke up gasping for air and ended up in the hospital. Doctors discovered that the excess fluid from her watermelon habit had overwhelmed her heart, a wake-up call that even healthy foods can have downsides. Extra caution is also needed for those on diuretics, water pills, for conditions like heart failure or high blood pressure. Watermelon can interfere with these medications, which are meant to remove excess fluid, by counteracting their effect and leading to dangerous complications. There's also a sneaky sugar spike. Although watermelon tastes light and refreshing, it has a high glycemic index, GI, meaning it can spike your blood sugar quickly, almost like drinking soda. The American Diabetes Association notes that just 2 cups of watermelon can cause a rapid rise in blood sugar levels for seniors with diabetes or prediabetes. This sugar rush, followed by a crash, can leave you fatigued and dizzy. Over time, frequent spikes can worsen diabetes control and increase the risk of complications like heart disease. Even if you don't have diabetes, these spikes can contribute to insulin resistance, which is a stepping stone to type 2 diabetes. And finally, watermelon is loaded with potassium. While potassium is vital for heart and muscle health, too much can be problematic for seniors with kidney disease. Aging kidneys struggle to filter out excess potassium, which can build up in the blood and cause hyperkalemia. Symptoms include irregular heartbeats, muscle weakness, and even heart failure in extreme cases. The National Kidney Foundation estimates that about 40% of people over 65 have some level of kidney dysfunction, often without realizing it. If your kidneys aren't at their best, piling on potassium-rich foods like watermelon could push them over the edge. So, how can you enjoy watermelon safely? If you love it too much to let it go, take some precautions. Keep portions small, stick to about half a cup per serving, to avoid overloading your system. Pair it with protein, like nuts, or fiber, like seeds, to slow sugar absorption and balance your meal, and avoid eating watermelon late in the day to prevent overnight fluid buildup. Listen to your body. If you notice swelling, breathlessness, or fatigue after eating, cut back. And if you're looking for hydration and sweetness without the risks, consider alternatives like cucumber slices, cooling, hydrating, and with no sugar or potassium overload. Frozen berries, a tasty, low GI option, or even water infused with a hint of watermelon juice and mint for flavor without the full fruit's risks. The bottom line is that while watermelon might look like a guilt-free summer treat for seniors, especially those with heart, kidney, or blood sugar concerns, it's a fruit to approach with caution. Moderation and mindful eating can help you enjoy it without jeopardizing your health. If you're still watching this video and finding these insights valuable, please comment number 1 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. 6. Papayas. Now, let's take a closer look at papayas, a tropical fruit widely known for its digestive benefits. Many seniors choose to eat papayas because they've heard it can help with gut health, digestion, and even inflammation. While it's true that papayas offer some health benefits, there's another side to this fruit that isn't often discussed. In fact, for seniors, papayas can cause several serious health issues, especially if you're on medication or have a sensitive stomach. One of the most significant concerns with papayas is how they interact with many medications commonly prescribed to seniors. The U.S. Food and Drug Administration, FDA, has noted that papayas can interfere with the absorption and effectiveness of several types of medications, including blood thinners, diabetes medications, and antibiotics. This happens because papayas contain an enzyme called papain, which can alter the way your body absorbs and processes certain drugs. For example, seniors who take blood thinners such as warfarin are at an increased risk if they consume papayas regularly. Papayas can enhance the effects of the blood thinner, increasing the likelihood of bleeding, a dangerous situation for people with blood clotting disorders. Similarly, if you take diabetes medication, consuming papayas can cause a drastic drop in blood sugar levels, which might result in dizziness, confusion, weakness, or even fainting. Let's consider the story of Helen, a 71-year-old woman from San Diego. After hearing that papayas could improve digestion, Helen started eating them daily. However, after a few weeks, she began noticing that her blood pressure medication didn't seem to be working as effectively. Concerned, she visited her doctor, who asked about her diet. When Helen mentioned that she had been eating papayas regularly, the doctor immediately suspected a drug-food interaction. Once Helen cut papayas out of her diet, her blood pressure returned to normal. Another lesser-known danger of papayas is their connection to latex allergies. Many people with latex sensitivities find that they are also allergic to papayas because the fruit contains proteins similar to those in latex. For seniors with latex allergies, eating papayas can trigger reactions such as skin rashes, itching, and swelling in the mouth. In severe cases, it can even cause difficulty breathing, which can be life-threatening. What makes this particularly concerning is that allergies to latex can develop later in life. Even if you've eaten papayas in the past without any issues, that doesn't guarantee you won't have an allergic response later on. It's always wise to be cautious and observe any changes in how your body reacts to certain foods as you age. Papayas are often touted for their digestive enzyme, papain, which helps break down proteins and other foods in the stomach. While this can be beneficial for some, it can pose a problem for seniors. Many older adults already have sensitive stomachs, and the strong digestive properties of papaya may irritate the stomach lining. This can lead to uncomfortable symptoms like bloating, gas, acid reflux, and even stomach cramps. If you've ever noticed discomfort after eating papaya, it might be a sign that your digestive system is struggling to process it properly, especially if you suffer from conditions like irritable bowel syndrome, IBS, or acid reflux. If you're looking to support your digestive health without the potential risks of papaya, there are plenty of other options. Plain yogurt or kefir are excellent choices, as they're rich in probiotics, which promote a healthy gut. Ginger tea is another natural remedy that can help soothe the stomach and aid digestion, while fermented vegetables like sauerkraut or kimchi provide beneficial bacteria that support digestive health. However, if you still wish to eat papaya, there are a few precautions you can take to minimize the risks. First, never eat papaya on an empty stomach, as this can increase the likelihood of stomach irritation. Second, if you take medications for blood pressure, blood thinning, or diabetes, be sure to consult with your doctor or pharmacist before incorporating papaya into your diet. Start with just a small portion, perhaps only a few bites, and carefully monitor how your body reacts. If you experience any symptoms like dizziness, stomach discomfort, or unusual fatigue, it's a sign that papaya may not be the best choice for you. Now that we've explored these 6 fruits, I'd love to hear from you. What's one thing you've learned today that surprised you? Drop a comment below and tell me one change you'll bring into your life based on this information. Maybe it's swapping out a fruit or being more mindful of your choices. Your feedback inspires me to keep creating content that matters to you. If you like this video, please leave your comment below and don't forget to like, share, and subscribe to our YouTube channel. It's a simple way to support us and help others discover these important tips. Thanks for watching. Stay healthy, and I'll see you in the next one.